My name's Elisa Koval. I'm the wellness physician for the Department of Safety in Denver, Colorado. I'm an occupational physician by training, and I specialize primarily in the care of public safety officers. I'm here today to give you a brief overview of the provider guide around firefighter physicals and why they're a little bit different from a regular physical that you would do for someone in the general population. First, I'll talk a little bit about why primary care docs are so very important in this discussion. Oftentimes, you as primary care docs, if that's your persuasion, are the first contact that firefighters will have with the healthcare system. You're the ones that they might see most regularly. Not every fire department has their own occupational physician, the way that some bigger departments do. But I think the key thing to remember there is having a higher index of suspicion for certain conditions and certain background issues that need to be evaluated in firefighters. And so we'll talk a little bit about that so that more screening and more treatment can be done. And I won't leave the firefighter out of that because, of course, it is absolutely on them to pursue their annual physical and make sure that that's getting done. And whatever you can do to develop that relationship with your firefighter patients is always going to benefit them in the end. So something to keep in mind. As far as risks are concerned, there's kind of three big categories, often referred to in the industry as the three-legged stool of firefighter health, which are not dissimilar from the general population, but I can definitely tell you that the risk is elevated. We're looking primarily at cancer risk, we're looking at cardiovascular disease risk, and we're looking at the risk for behavioral health conditions based on the nature of the job. A little bit on the cancer front, as you can imagine, there are occupational hazards that are unique to firefighting. You've got physical exposures that include fire itself. You've got the shift work schedules that a lot of people work. You've got chemical exposures around, the products of combustion and some of the chemicals that are used to actually extinguish fire. You've got biological exposures in the form of viruses, as we just saw during a pandemic when a lot of medical call work is done. Of course, there's ergonomic risks and psychological risks as well. But as far as cancer is concerned, there's a lot of good studies out there establishing the increased cancer risk in the firefighter population because of these unique job risks. Similarly, especially on that shift work topic, a contributor to stress and cardiovascular disease. We're looking at a lot of nervous system imbalance in these folks because of the work that they do and because of the fight or flight stimulation that they experience far more than the general population, which can manifest in the way of blood pressure. It can manifest in the way of elevated cholesterol. Underlying a lot of that is kind of the stress hormone axis and the long-term and sort of downstream effects that it has on the cardiovascular system. So it's just something to have a heightened awareness about when you're seeing your firefighter patients. And then finally, as you can imagine, whether it's a fire scene or a simple medical call, the potential for trauma exposure and mental health effects of that is huge in this population. And the thing I'll mention there is that culturally, they're caretakers. These are folks who run toward danger to take care of other people. They don't necessarily consider taking care of themselves quite as much of a priority as they do taking care of others. So it's something to ask about in a very direct but very compassionate way. And that's part of the cultural competence we're trying to achieve in an annual physical. So a couple specifics about doing a general exam on a firefighter. In general, I think it's wise to have a lower threshold to take additional steps to screen, and particularly in the areas that we've already mentioned. Doing annual blood work that screens for all of these, as many of these or disorders as possible is absolutely key. And stemming from that, calculating a 10-year cardiovascular risk is a wonderful starting point to do additional cardiac screening, whether that ends up being a simple screening EKG or a coronary calcium score or a stress test. That ASCVD 10-year risk is a wonderful starting point. Another super important thing to cover is family history. I mean, a rule of thumb in the general population is that if a first degree or even second degree relative has a particular cancer, then starting to screen for that 10 years earlier in any individual is a reasonable thing to do. I'd say you can probably consider firefighting a similar risk, a similar exposure factor, and you want to start screening for that on average 10 years earlier than any of their family members may have experienced it. When it comes to cancer screening in general, you know, the USPSTF guidelines, they're quite thorough. I think the concept of shared decision making in the primary care realm is a super important one, because as you might consider family history or a particular work exposure kind of an extra reason to do a screening test, I think the same thing goes here, and firefighting is another extra reason. It's another impetus to conduct that colonoscopy at age 45, or to conduct that colonoscopy if someone is having symptoms, you know, something similar. And then the last thing I'll highlight is, you know, as far as physical exam is concerned, a lot of things, you know, physical exam is not the most important way to screen for particular cancers, but I will say that doing a good skin exam, doing a good neurological exam, doing a good oral inspection, doing testicular and breast exams, and doing a thyroid exam are sort of the highlights of the physical exam that don't necessarily have another perfect screening test associated with them. As you can see, there are a number of good resources if you look at the QR code on our provider guide, so you can get a lot more detail on each of the issues that we've just discussed. But in general, I think having a lower threshold to act and a higher index of suspicion in this population is a super important thing to think about. Thanks very much, and have a good day.